Good day everyone, this is Heber Ina Pizarros, a student nurse from Davao Doctors College. And today I'm going to perform or demonstrate the assessment of the abdomen. So prior of doing the procedure, we need to review our client's previous medical records and doctor's sheet if available. This is for us to be guided during the assessment. Okay, here we need to review our client's previous medical records. After that, we need to determine the scope of assessment needed and prepare the necessary equipment. So it is extremely important for us to maintain the equipment efficiency and to provide quality care. As I am doing the procedure or assessment, I am going to need the stethoscope, and then I'm going to need the gloves and the beddings for my clients in a supine position, the pillow, etc. So after determining the scope of assessment needed, and we just done or the equipment, and then now is we need to perform hand washing and don gloves if deemed necessary. This is for us to deter or prevent the spread of microorganisms. Now I'm going to don the gloves. So it is very important for us upon doing the abdominal assessment to our patient. So now we need to greet our client politely and client's companion if around. We need to introduce ourselves and verify our client's identity. So the rationale for this is to introduce himself to the client enhances rapport. So verifying the client's identity ensures care is being rendered to the correct client. So ask how the client would like to be called during the assessment. So at the same time, we need to establish rapport with our client. So establishing rapport is to ensure entrusting relationship towards our client. So after that, we need to explain the procedure to the client and how he or she can participate during the assessment. Provide the client the opportunity to clarify, ask, or raise any concern. The rationale for this is to explaining the procedure to the client can reduce clients' anxiety and enhance cooperation. So we need to ensure our clients' comfort, privacy, and confidentiality. So assessment setting was assured to be safe, secured, and free from distraction. So position our clients to be seated comfortably. And women, we need to drape the anterior thorax when it is not being examined. So and the procedure number 7, we need to ensure that the client has emptied his or her bladder. So, okay sir, kumusta tayo sir? Ako nga pala sir, si Hebel Ilatisang sir from Davao Doctors College sir. Ako yung nurse mo for today sir. And I'm going to assist yung abdomen po natin sir. Masa ganit pangalan natin sir?
I'm John Fernando Rosales.
John Fernando Rosales sir. Can I check your wristband natin sir? Can you tell me your age and birthday sir?
I'm 19 years old and my birthday is April 27, 2001.
Okay sir. Ano gusto niyo sir? Itawag na ako sa inyo sir?
John na lang.
Okay. Okay, Sir John. Karang Sir John is magagawa ta assessment of the abdominal. So, i-check ko sir kung naabay mga sign of tenderness, naabay mga bulging, naabay mga abnormal findings na upon doing the assessment, sir. So, but rest assured, sir, na upon doing this assessment, walay makakita, sir. So, yung full privacy and confidentiality, sir, makikater na ito sa inyo, sir. So, okay lang ba sa ato ana, sir?
Okay lang po.
Naabatay mga pangutana na, sir?
Wala na po. Okay naman.
So, sir, kung gusto mo, sir, take a void or mag-CR ka, sir, kay we need to ensure our empty bladder natin, sir, para continue yung assessment natin, sir.
Okay naman po kanina. Tapos na po kanina.
Thank you, sir. So now we are now going to assess the surveying of the abdomen. So in surveying the abdomen, we need to position our client in a supine position. So making sure that the from the head to torso are in same plane. So and we need to ensure that the client is in comfortable. Okay. So this is necessary to completely relax the abdominal wall muscles. After that, we need to cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. So the rationale for this, or the reason for this, is to avoid exposing the lower body parts of the patient. Okay, so sir, mag-treat ko na, cover tayo yung Now, we need to observe the abdominal skin. We need to take note for any vascularities. So, visible dilated, for example, spider veins and etc. So, the rationale for this is dilated superficial capillaries without a pattern may be seen in older clients. So, they are more visible in sunlight. So, after that, we need to note for any stray or stretch marks. So, after noting for any stray, we need to assess now for any scars, lesions, and rashes. So, scarring should be an alert for possible internal adhesion. So, sir, mag-note na ako, sir, sa abdominal skin po natin. Sir, no, akong naabay mga stretch marks, na ay mga some abnormalities. Okay, sir. Okay, sir, So upon surveying the abdominal skin of my client, so there are no I did not see, or I did not able to note any abnormal findings. So it is only means that my patient has a normal findings in his abdominal skin. So now what I'm going to perform is we need to inspect the umbilicus of our patient. So we need to inspect for its color, contour, and its location. So this is to know if the patient umbilicus is normal. So in inspection of the umbilicus, so the normal findings will be flat or round. So if there are any sign of distension or distendeds, well, that signifies that our patient has a abnormal findings of his umbilicus area. So okay, sir, mag-press na ako, sir, sa umbilicus natin, sir, no? Titingnan ko, sir, kung normal ba na, sir. So kung titingnan ko, sir, kung round or flat ba yung umbilicus natin, sir, no? Okay po. Okay. So now is we need to inspect for contour. Now is while the patient lies that the supine on the bed beside the client, look across the abdomen and then at a level slightly higher than the client's abdomen. So this is to detect the tenderness, mass, bulginess, and swelling. So sir, mag-inspect ako ulit mo, sir. Akong i-inspect kung there are sign of tenderness, bulging, sir. Okay. So upon inspecting of our client, so I did not note, or I was not able to note any sign of tenderness. So it signifies that our patient is normal. So now what we're going to perform is we need to measure the abdominal girth of our patient using a tape measure or measuring tape. So we need to ensure that the client has emptied his or her bladder. So the rationale for this to avoid distraction during the assessment and to eliminate the bladder. So prior of doing the procedure, we've already asked our patient that he's already went to CR, and this signifies that he has already emptied his bladder, and in order for me to or us to continue our assessment. So after that, we need to position the client in a standing or in a supine position. So client's head may be slightly elevated for orthopedic patients. So this is possible to provide with stability and comfort, which will leave them calmer and more relaxed. So, sir, okay lang ba, sir, standing position ta, sir? Yes. So I'm going to measure, sir, your abdominal circumference, sir, using tape measure. So we need to use a disposable and easily clean tape measure. So if tape measure is not available, use a strip of cloth or gauze, then measure the gauze with the cloth tape measure or yardstick. So this is to know, measure and monitor the dimensions and changes of the abdomen. So we need to place the tape measure. We need to place the tape measure to the client and measure starting from the umbilicus. So the umbilicus should be starting point when measuring the abdomen. So especially with the distension is apparent. Okay, so sir, mag-measure na ako, sir. Here. So starting from the umbilicus. So ganun lang, so inch by inch. So now we're going to perform in checking for symmetry. So we need to ask our client to raise her head for the assessment so that we will assess for if there are some herniation or diastasis or there are some bulgeness in his abdomen. So sir, mag-raise ganit konti yung head natin, sir. Okay. So after raising our client's head, now is we need to detect for so that we will detect some abnormalities. So we need to inspect the abdominal movement when the clients breathe. So okay, sir, hinga ganito, sir. Breathe, inhale, exhale, sir. So upon our client is breathing, we need to observe this to determine if he or she has abnormal breathing. So and after that we need to observe for some peristaltic waves. So if you notice some peristaltic waves, so this indication that our client is normal. Okay, sir, continue breathing ganun, sir. Inhale, exhale. Okay, upon inspection, so I've noted that there are some peristaltic waves, so that indicates that our patient is normal. So there are no sign of abnormal breathing. So since he was able to breathe, and I found out that our patient's breathing is normal. Now is we need to auscultate for vowel sounds. So we need to use the diaphragm of the stethoscope, this one, and make sure that it is warm before placing of the abdomen. So the rationale for this is the diaphragm of the stethoscope will allow you to hear high-pitched sounds. So make sure that your hands and the stethoscope are warm so that the abdominal muscles do not contract or contact. So here. So we need to warm our diaphragm stethoscope and at the same time our hands. We need to apply light pressure or simply rest the stethoscope if the abdomen is tender or painful. So this is for us to good lighting is essential. It is helpful to have the tangential available. For this can be create a subtail with shadows of abdominal wall masses. So we need to perform auscultation starting with the right lower quadrant, then clockwise. So starting from the RLQ, so right lower quadrant, and then up to the right upper quadrant, then left upper quadrant, then our left lower quadrant, so clockwise. Okay, so here, starting from the right lower quadrant to right upper quadrant, then left upper quadrant, then our left lower quadrant. Okay. So we need to listen to each quadrant for 5 minutes, minimum 1 minute per quadrant, to confirm any absence of vowel sounds. This is document if it's normal, hyperactive, or hypoactive. So note for any of intensity, pitch, frequency of the sound. So upon auscultating our the 4 quadrants of my patient, so I've noticed that the vowel sounds are normal. So I was not able to hear any abnormalities. So now we need to auscultate for vascular sounds. So we need to use the bell. So in auscultating the vowel sound, we use the diaphragm. But in auscultating for vascular sound, we need to use the bell of the stethoscope. So using the bell of the stethoscope, we need to listen for bruits, low pitch murmur like sound pronounced over the abdominal aorta, renal, iliac, and femoral arteries. So this is to determine for any problem. So using the bell of the stethoscope, we need to start from the abdominal aorta. So here from aorta, renal, so iliac, and then femoral. So upon auscultating for the vascular sounds, I was not able to listen for any bruits. So this signifies that the vascular sounds for our patient is normal. So now we need to auscultate for venous hum. So at the same time, so we need to use the bell of the stethoscope to listen for venous hum in the epigastric and umbilical areas. So using the bell of the stethoscope, so we're starting from the epigastric and umbilical areas of the patient. So in auscultating for peritoneal friction rub over the liver and spleen, so we need to place the diaphragm of the stethoscope over the right and left lower rib cage and listen for friction rub. So this is to indicate if there are inflammation or tumors. So we need to place the diaphragm stethoscope in the right and left lower rib cage of our patient, and we need to listen for some peritoneal friction rub. So now what we're going to do is we need to percuss for tune. So in percussion, we need to, with the percussion, or we need to use or utilize the hand technique. So lightly and systematically percuss all quadrants. So percussion may be proceed clockwise or up and down over the abdomen. So in the mid-clavicular line, so we have 4 quadrants. So starting from the clockwise, starting from the right lower quadrant, then up to the right upper quadrant, then left upper quadrant, then left lower quadrant. So clockwise. So this is to assess for the distribution of tympani and dullness. So now what we're going to do is we need to percuss the quadrants. So systematically, so we just need to use the hand technique. So I did not in percussing for the tone, so using the quadrant of our patient, so I was not detect or was not able to detect any dullness, but there are tympani. So it signifies that the tone of our patient is normal. So in percussing the span or height of the liver by determining its lower and upper border, we need to determine the lower border by percussing the beginning from the right lower quadrant. Here, right lower quadrant at the mid-clavicular line, then upwards. So note the change from tympani to dullness. So this is the reason for that is tympani should predominate because of the gas in the gastrointestinal tract. So mark the area of dullness. This is the liver border of dullness. So this may indicate further assessment for acids. So upon percussing, so I was not able to the dullness. So tympani was predominant while percussing the lower and upper border of the patient, which signifies that our patient is normal. So in assessing the descent of the liver, we need to locate the liver border of dullness. Okay, so while locating the liver border of dullness, we need to ask the client to take a deep breath, then observe for the descent of the lower border of the liver dullness below the costal margin, and deep inspiration in the client hold his or her breath. Hold his or her breath. So this is to assess the descent of the liver. So and after that, we need to perform percussion and ask the client to exhale afterwards. So this is to promote relaxation. Okay, sir. Take a deep breath, again, sir. Okay. Hold your breath, sir, and then inhale, exhale. Exhale, sir. Okay. Thank you, sir. So now in percussing the upper border of the liver, we need to locate the upper right chest at the mid-clavicular line and percuss downward. So the liver is located at the right upper of the abdomen. So we need to mark the point where the change from the right upper chest or lung resonance until liver dullness is noted. This is the upper border of dullness. So the rationale for this is marking the point of change helps to determine the area of dullness is noted. So at the same time, we need to measure the distance between the two marks. This is the liver span. So this is for us to measure, helps in determining the distance of the liver span. Okay. So here, upper, downward. We need to percuss downward. No? Okay. We need to percuss until the dullness is noted. So, if the dullness is noted, we need to mark the or measure or the point from change from resonance to dullness. So, okay. So after measuring, so we just need to repeat the percussion of the liver at the mid-sternal line or MSL. So this is to determine if there is any distension. In percussing the spleen, we need to begin percussion in the posterior to the left mid-axillary line or MAL and percuss downward. So percussion it gives resonance. This step helps identify areas of the lung devoid of air. So note the change from lung resonance to splenic dullness. So at the same time, we need to perform a second method of percussion to determine enlargement by asking the client to take a deep breath and start percussing on the last left interspace of the anterior axillary line or AEL. So dullness of the left anterior chest due to the heart and right lower chest due to the liver. Okay. So we need to start at the upon percussion of the spleen. We need to start, as I've said, we need to start from the left mid axillary line here. So downward. So upon percussion, we need to use our fleximeter finger here. Okay, sir. Inhale, exhale. Take a deep breath, sir. So now we're going to assess for blood percussion on liver. So blood percussion in the liver denotes if there is pain and tenderness. So upon doing the assessment, we need to ask our client to sit with his or her back to you. Okay. Sir, pwede ba sir sitting position pa sir? I'm going to assess blood percussion on sir. Okay, sir. Sir. Okay. So after positioning our client in a sitting position, we need to place our left hand first against the lower right anterior to rib cage. So after that, we need to use the ulnar side of the right first and strike the left hand. So note for any tenderness upon percussion. So, may masakit ba, sir?
Wala naman.
Wala naman, sir.
Wala po.
So, now is we need to blunt percussion on kidney. So, kidney tenderness is assessed at the CVA. So, we need to ask our client to sit with his or her back to you. So, same position or same procedure as what we have done on the percussion or blunt on the liver. So, we need to ask our client, we need to place our left hand on the costovertebral angles and then repeat step 44 to 45. So in step 44 to 45, it is in the mid-clavicular line. So here, the way how we perform. Okay. Test for abdominal distension, bulging, flanks, or ascites. So in doing that procedure, we need to percuss the flanks from the bed toward the umbilicus upward. So this is we note a client with when he or she has a distended abdomen. So, okay, sir. And then after that, the Russian for that can be detected by eliciting shifting dullness. So note the change from dullness to tympani in mark this point. So upon doing that, so we need to assess the client to turn onto the side and then percuss the abdomen from the bed upward. So mark the level where dullness changed to tympani. Okay, sir, pwede sir mag side lying, sir, lateral, sir. Okay. So we need to percuss the abdomen from the bed upward. In doing this, so we will note the change from tympani to dullness, and if the patient has a abnormal findings. Okay, upon doing that abdominal distension, so I've noticed that the patient is normal. So from the there are almost no dullness that I've noted. So that signifies that our patient is has a normal findings. Performing the fluid wave test. So the rationale for this test for ascites is free fluid in the abdominal cavity. So we need to ask our client to place the ulnar side of his or her hand and the lateral side of the forearm firmly at the midline of the abdomen. So firmly place the palmar surface of fingers and hand and against one side of the client's abdomen. So we need to use the other hand to go to top to the opposite side of the abdominal wall. Note for any fluid movement. Okay, sir? Mag-test ko for fluid test. No, sir, kindly put down your hands natin dito, sir. Okay. Yes, sir. Yes, sir. Okay, sir. Okay, so upon doing that so I've noticed that the fluid movement of our patient is normal. Upon doing the palpating, we need to position the client in draping them, provides comfort in only exposing the abdomen, and to give focus on areas that need to be examined. So, from positioning the client back in a supine position, we need to cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. The rationale for this is the patient allows us to thoroughly palpate the areas that are not tender to avoid giving discomfort of the patient. So this is actually to at least provide privacy of the patient, not to expose the, especially in women, not expose the anterior thorax. Okay, we need to start or begin palpating on a non-tender abdominal quadrant. So this actually allows thoroughly palpate the areas that are tender to avoid giving discomfort to our patient. So we need to use our fingertips to compress a quadrant to a depth of 1 centimeter in a dipping position. Left fingers gently and proceed to next quadrant. Okay. So, sir, mag-start ako, sir, sa pagpalpit sa mga non-tender.
Okay
So,
po.
dito, sir, do you feel pain, sir? Nakakaano?
Wala.
Okay. Here.
Wala.
Okay, so femoral. So now we need to begin palpating deeply in all quadrants to delineate organs. So use the palmar surface of the fingers to compress quadrants to a maximum depth of 5 to 6 centimeter. Okay. Note for any resistance or any deeper measures, perform binomial palpation. Okay. Sir. Okay. So by manual palpation determines the size and nature of the uterus and the presence or absence of adnexal muscles. Sir, may nafe-feel ka, sir, ng mga answer? Pain, sir?
Wala.
Okay. Now is we need to perform the palpate for muscles. So the rationale for palpating the muscles is light palpation minimizes the chance of abdominal muscles to get tensed or rigid, in noting for muscles if present that may affect the patient's health condition. So in palpating for muscles, we need to use our fingertips to compress all quadrants to a depth of 1 centimeter in a dripping motion. So note for any muscles and its size in centimeter. So we need to note for its location, shape, consistency, demarcation, porsality, tenderness, mobility. Okay. So, okay, sir, magpalpit ako sa masses natin, sir, in all of your paddles, sir. Okay. So, in 1 centimeter. We need to assess for there are some tenderness or distension down there. Okay. So next is we need to palpate the umbilicus in its surrounding. So note for any swelling, bulgeness, and masses. So, sir, mag-assess ako sa umbilicus nato na sir dito sir. So, upon palpating the umbilicus of my patient, so I did not notice any sign of abnormal findings like swelling or bulges. So, it signifies or it only pertains that our patient has a normal state of, has no abnormal findings at all. So, in palpating the aorta, we need to use our thumb and first fingers or use both hands to palpate deeply. So here. Palpate or palpating the liver. So in palpate the liver, we need to stand at the right side of the client. So we need to, this is the reason for this is to free accessibility to the side or body part being examined. So this is to approximate liver size, feel or for tenderness and masses because many of the findings of liver disease are found outside the abdomen. So in doing that, so we need to place the left hand under the client's back at the level of 11th and 12th ribs. Lay right hand parallel to the right hand costal margin. Fingertips should point toward the client's head. So we need to ask the client to inhale, then compress upward and inward with fingertips. So, and aside from that, we need to note for consistency and any sign of tenderness. So, yes, sir. Inhale, exhale gan, sir. Again, sir. Sir, thank you, sir. Now is what we're going to do is we need to palpate by hooking. So in palpate by hooking, we need to stand to the right of the client's chest. Free accessibility to the side or body part being examined. So the rationale for this is to approximate the liver size, feel for tenderness and masses because many of findings of liver disease are found outside of the abdomen. So what we're going to do is we need to coral hook the fingertips of the both hands just like this. And then we need to, the edge of the right from the costal margin, we need to ask the client to take a deep breath and gently but firmly pull inward and upward in your fingertips. So aside for that, we need to note for any consistency or any signs of tenderness. Okay, sir. Inhale, exhale, sir. Take a deep breath. Okay. Exhale. Take a deep breath, sir. Exhale, sir. Okay, last one. Okay. Sir, thank you, sir. So, in palpating by hooking, so I've noted that there are no signs of tenderness upon doing that assessment towards our client or patient. Test for cholecystitis. So, in testing for cholecystitis, we need to press our fingertips and fingertips under the liver border at the right costal margin. So right costal margin, also known as the right costal arc. So it asks the patient to inhale deeply. So the rationale for this is cholecystitis is inflammation of the gallbladder. That is why it is very important to note for tenderness. So after doing that, so we need to note for the right upper quadrant pain and for sign of tenderness. So here at the right from the chest at the lower edge of your ribs, rib cage. So sir, inhale, exhale sir. Okay. Okay sir, exhale. Okay. Okay. After doing the test for cholecystitis, I've noted that there is no sign of tenderness. So after that, we need to palpate for the spleen. So in palpating for the spleen, we have two-way methods. So I'm going to choose the first method. So in the first method, we need to stand at the right side of our client. So, but before that, the rationale for this is to so we can effortlessly reach for the patient's abdomen using our left arm, considering for spleen tenderness that can denote inflammation, or spleen tenderness can denote inflammation. So after standing at the right side of our client, we need to reach over the abdomen with the left arm and place the left hand under the posterior lower rib cage up gently. So after that, we need to place our right hand below the left costal margin with the fingers putting toward the client's head. So, and after that, we need to ask our client to inhale and press the inward and upward with providing support with the other hand. So, and of course, we need to note for any sign of tenderness. Okay. So, sir. This one. Okay, sir. After as I am putting my left hand to the posterior lower pitch of my patient, I need to ask, as what I've said earlier, I need to ask my patient to inhale and exhale. Okay, sir. And then exhale po tayo, sir. Okay. Okay, sir. Okay, last sir. Inhale, exhale, sir. So that is how to perform the palpate for spleen in first method. Palpate the kidneys. So the rationale for the palpate for the kidney, this is to provide the client comfort and at the same time give us easy access on palpating the kidney and observe for any tenderness or masses for both left and right kidneys. So in performing that, we need to place our left hand on the right posterior flank for provide support. So, sir, ilagay ko, sir, mag-perform ka sa palpate for kidney, sir. Okay, sir. Sir. As I am going to put my left hand to the right posterior flank of my patient, I need to put my left hand to the right upper quadrant. So after putting our left hand to the right upper quadrant, we need to ask our client to exhale and hold his breath briefly. So gradually release the pressure of right hand, then repeat the steps for the left kidney. So for beginning palpation, we need to the symphysis pubis and to move upward and outward to estimate the bladder borders. Yes, sir. Yes, sir. Inhale, exhale, sir. Okay, hold your breath. Inhale, exhale, sir. Sige, sir. Isa pa, sir. So, we need to repeat the procedure to the left kidney. So, sir, mag-proceed ka sa left kidney natin, sir, no? Yes, sir. So, sir, sir. So as I am doing the palpation for the kidney, I noticed that there were no sign of tenderness or masses upon doing that procedure to my or to our patient or client. Perform hypersensitivity test. So in performing hypersensitivity test, the rationale for this is exaggerated skin reaction might indicate an allergy. So if ever noted, allergy treatment plan must be assessed to avoid allergy. So in doing that, so stroke the abdomen with a sharp object, broken tip applicator, tongue, blade, or grasp a fold of your skin with your thumb, index finger, and quickly let go. So repeat step 102 several times along the abdominal wall, and we need to note for pain of exaggerated skin reaction. Okay, sir. Sakit, sir?
Hindi.
Okay. Yes, sir.
Hindi.
Okay. Okay. Okay, repeat ko, sir, circular. Sir. Okay. Okay. Test for psoas. So, in testing for psoas, we need to ask the client to lie on the left side. So, the rationale for this is free accessibility to the side of body part being examined. So, the rationale for this is because it may result in contraction of the psoas muscle, which causes pain if there is the underlying inflamed appendix. Okay, sir, pwede sir mag-lie on the left side na sir. Sir. Okay. So, after positioning our patient in a lie on the left side, so what we're going to do is we need to hyperextend the right leg of our client or patient, and at the same time, we need to note for any pain and reaction of the client. Sir. So, sir, can you, sir, ako na hyperextend ko, sir. Sir, ang stay. Sir, nakabalik, sir, na-feel na pain dito, sir. Last. Okay. Sir, spine position. So after performing the psoas test, now we are going to perform the test for obturator sign. So the rationale for this is to increase pain at the right lower quadrant, suggest inflammation of the internal obturator muscle from overlying appendicitis or an abscess. So upon doing that, we need to hold and support the client's right knee and ankle, flex the hip and knee, and rotate the leg internally and externally. So, and of course, we need to note for any sign of pain and reaction of the client or patient. So, sir, mag-perform ko, sir, obturator test now. Sir, so, pain, sir, sir, tapos, okay. Sir, may nakfit na, sir, ng pain, sir?
Wala po. Wala siya.
So, test for appendicitis. So in testing for appendicitis, we need to assess for rebound tenderness by palpating deeply at 90 degrees into the abdomen away from the painful or tender area. So rationale for this is near painful areas may cause anxiousness and discomfort to the client or patient. And it increased pain on the right side chest, right-sided peritoneal irritation, and that might be an indication of acute appendicitis. So suddenly, release pressure, listen and watch the client's expression of pain, and we need to ask the client which hurt more, expressing or impressing or releasing the pressure. And at the same time, we need to ask our client where in the abdomen the pain has occurred or its location. Okay. So sir, mag-perform ako appendicitis, o I'm going to perform kung naabatay mga sign ng appendicitis dito sa appendix area po natin, sir. So sir, nakasakit, sir?
Wala naman.
So again, sir, nakasakit, sir, sa mga pain?
Wala naman.
So upon doing the test for appendicitis, the as what my patient verbally told me that there's no sign of pain that he is experiencing or is there's no sign of pain that he feels. Summary and closing phase. So we need to help the client to put back into his clothes and position the client comfortably on a bed. So the rationale for this is give patients comfort after the assessment. So the purpose of this is to offer information about the assessment being performed while ensuring that they have understood the procedure being done, and to show appreciation for their participation throughout the assessment. And of course, we need to perform hand washing after the assessment to deter the spread of microorganisms. So, hand hygiene can do. And of course, we need to summarize the information obtained during the working phase and discuss the findings to the client. Discuss the client possible plans to resolve health concerns, and if present, assess for the client's understanding of the plan and the need for further teaching. This is to provide the client the opportunity to clarify or ask or raise any concern. Thank the client at the end and the interview politely, then aftercare and perform hand washing or hand hygiene can do. Document findings and the client record printed or electronic forms or checklists supplemented by narrative notes when appropriate. So this is to the documentation of the client care is important. This is because this carries out professional responsibility and ensures reimbursement, and of course because client records are legal document. Okay, sir. Tapos na aton pag-assess sa abdominal natin po, sir. So, okay, sir, pwede ano na tayo sa post natin, sir. So, sir, kumusta, sir, na aton assessment, sir?
Okay naman siya.
Okay, sir. So, and then, sir, upon doing the assessment, sir, so upon doing the findings ko, sir, sa inyong sir is almost normal naman siya from the there are no abdominal girth when I measure your the circumference of your abdominal muscles, and then there are no signs of appendicitis and so on and so forth. So, sir, sa may mga katanungan ko, sir, sa plano na ako, sir, sir.
Okay naman po siya. Ang akin lang, kung nafe-feel ako, anytime pwede ako makabalik sa'yo or makabalik sa hospital mo.
Okay, sir. That's good na, sir. So, thank you, sir, sa imo, sir, cooperation, sir. And kung lang good, katong kung may mga further mga question pa ta, ano lang good ta, like, mag-check up na, sir, tapos, ganun, sir. So, thank you, sir, tayo, sir, participation natin, sir, no? So, let's end our abdominal assessment, sir.
Thank you.